Dr. Pollei, what are the signs of skin cancer?
So signs and symptoms of skin cancer go back to the good old-fashioned ABCD criteria that we've talked about for years. So first we talk about asymmetry, and if you look you can see any skin lesion anywhere that has any sort of an asymmetric border. B goes right along with that. C is for color. In this case, anything that's kind of a light brown or something that's reddish and then suddenly goes changing, or if it has any color variation within it. D is for dimensions. Usually we say anything up to 1 centimeter can be safe, but not always the case because we'll often see some lesions smaller than that. And then lastly, E, which is evolution. And if you start off with a lesion that starts as kind of something small or seemingly insignificant, and then it slowly grows, changes, or even worse, rapidly changes, then it's a concern. If any of the other symptoms we'll always talk about, like bleeding, crusting, scabbing, scaling, specifically pain, if any of those occur, then it's definitely a concerning something, and the likelihood of it being a skin cancer is dramatically increased.
How do I get skin cancer?
Good question. So you get skin cancer typically from sun exposure, but that's not the only way you can get it. Talking about the sun exposure, it's usually repeated heavy doses of sun exposure in your younger years. So it can even be those kids that are preteen, teenage, into your 20s. The problem being you don't often see the skin cancers develop until you're into your, depending, 30s, 40s, 50s, 60s, 70s, 80s, and by then the damage is done, and it's really from decades earlier. Also, we'll talk about things like immunosuppression. We see an increased risk of skin cancer in patients that are on chemotherapy or have any sort of immunosuppressive disease. Also, there are some genetic components to it. There's some family history, syndromes, etc., that raise the likelihood of getting certain skin cancers, melanoma specifically, but those aren't quite as common. So big picture, if anyone asks, the real answer is sun exposure, UV exposure, etc.
What are the different types of skin cancer?
So regarding skin cancer, it's not just the actual cancer itself. Remember, we're going to talk a little about the benign lesions that can precede it, because they often can degrade into skin cancer. Anything from a melanocytic nevus, which is kind of like a mole, or a fibroma, or little angiomas, little red spots, anything that looks totally benign, that's one of those reasons you keep an eye on it to make sure it doesn't go downhill. With skin cancer itself, there's really 3 types we talk about, and all of these are the common cutaneous malignancies: basal cell carcinoma, squamous cell carcinoma, and then malignant melanoma. Each of those have their own subtypes, and they're kind of in that order as far as degree of severity. So basal cell carcinoma is the least aggressive, least severe. It doesn't usually cause any distant spread, whether it be to brain, bones, liver, etc. It just erodes and causes problems right there. There's different subtypes: superficial, nodular, etc., etc. The more aggressive the subtype, obviously the more aggressive the treatment needs to be. With squamous cell cancer, they usually are more superficial, but they can spread through lymph nodes specifically. You can also have perineural invasion and spread. So that's let's treat it quick while we got it, even if it's an in situ disease, not a true squamous cell carcinoma. And then lastly, malignant melanoma. That's the one that has a degradation often from a nevus or a mole that has not just atypia in multiple levels, but it's actually not in situ disease, but true malignant melanoma. And that's kind of the more aggressive, more severe of all the cutaneous malignancies, and the one that we want to treat the most aggressively out of the gate.
What is the treatment for skin cancer?
Treatment for skin cancer kind of varies. It can be anything from do nothing and just play the observation game, watching to see if any of those A, B, C, D, E changes occur. It can also be a little bit more conservative, whether that be a chemical cautery, a thermal cautery like a bifurcator, some sort of electrodesiccation. Some topical skin cancers that are, cutaneous skin cancers that are very superficial, like a superficial basal, you can use things like 5-FU or other chemotherapeutics in topical form, like Fudex. When it comes to malignancies that have progressed past the dysplasia or in situ disease state, and they're actual cancer, like a true basal cell carcinoma, squamous cell carcinoma, or malignant melanoma, then usually it's a surgical excision. We call that a wide local excision, and depending on the size, something more aggressive from a reconstructive perspective is needed. If it's in an area that's a really high stakes area, like in the nose, eyelids, ears, somewhere that you can't just cut and close easily, we'll often couple that with Mohs reconstruction, which is a dermatologic resection where we look for margin edges really close. versus something that's done kind of in a single stage where it's excised and closed. The margins for that vary from just a couple millimeters, 3 millimeters for basal cell, up to a centimeter plus for a malignant melanoma, or even in a higher stage malignant melanoma, a huge excision with sentinel lymph node biopsy, etc. So there's a varying degree level of treatment, therefore it's key to get the right diagnosis. And that usually occurs with either a scrape, a biopsy, or some sort of right now get an answer with pathologic assistance.
How do I prevent getting skin cancer?
So the prevention of skin cancer is somewhat challenging because even though our society is better today than it was 3, 4, 5, 6 decades ago for UV ray and sun protection, we still kind of want that little sun-kissed glow, and most patients feel better in the sun. Guilty. So I can't say much. But the best way to prevent skin cancer is sun avoidance and sun protection. Remember that being in the shade does not mean you're completely avoiding any UV exposure. It is decreased, but it's not avoided. A cloudy day, you still have a significant amount of UV exposure, as anyone can attest to that's had a sunburn from a cloudy day. So keeping covered up, wearing hats, wearing sunglasses, and wearing SPF is key. So sun protection factor, SPF, has really been formulated, and the recent technological advancements of the compounds really make it so you can put on the SPF and go about your day without it rubbing off as quickly. Remember, SPF means you can spend that many minutes in the sun to equal 1 minute with nothing. So an SPF 30 means 30 minutes in the sun with that covering the skin area equals 1 minute with nothing. But an SPF 80 will likely rub off or sweat off or just absorb in long before you get that full 80 minutes of value. So reapplication of SPF, aside from avoidance, is really the next best technique. UV rays are always going to be the highest between about 10 a.m. and 2 p.m. So if there's a golden time to avoid the sun or use good sun protection, that's it. But it even spreads out a little to that 9, 10 o'clock and even up to the 3, 4, or 5 o'clock. When the UV index is up in the 11 and 12, as it gets here in California in the summer, we get a little bit nervous about anyone that's out in the sun without any sort of sun